Now, the government of Malawi, the Ministry of Health, has partnered with Lifeline Malawi in another aspect with regards to HIV/AIDS intervention, and that is the supply of the antiretroviral medication that we give to the HIV positive people. But Lifeline Malawi could not do that without being certified. So I understand that there's individuals from the ministry that will visit the clinic from time to time to make sure that we are operating under certain standards. You probably haven't had to do that yourself, but no doubt your staff have come back with reports. Some of these people that George has talked about that travel for miles to see us will do so by walking or by bicycle. And in turn, Lifeline Malawi will go out into those communities by motorcycle or bicycle, depending upon how far away it is. The next area I'd like to talk about is maternity. And we understand that maternity is a great area of need in Malawi. The statistics are astounding. It's been as high as 1 woman per 200 births dies during childbirth, compared to 1 in 1,000 or something like that in Canada. Lifeline Malawi is now involved in maternity. What does that mean to you and what we're doing in the area?
I was fascinated. I mean, recently you recall that we opened this facility at the new center in Kasese, and the relations and happiness and the bright faces by the women around that area really showed it all. The issue is when the service is far away, this patient has to prepare for monies to be used to ferry him or her to the next facility. And because of poverty levels of most of the people around these facilities, they decide to use traditional birth attendants. And with due respect, traditional birth attendants are not giving the maximum attention to the ailments of the pregnant women. So both in Ngozi and Kasese, the introduction of the maternity service is a milestone in the activities of Lifeline, because it's going to reduce the maternal death, it's going to reduce the problems that women have hitherto experienced. There is no reason for why a person around Ngozi should not go for antenatal. But there was a reason why the person could not travel all the way about 40 kilometers to Salima District Hospital to have antenatal, because of the distance and also the cost involved.
Right.
Yeah.
So this maternity is now happening at both sites, the Ngozi as well as the Kasese site, both of which were funded by other organizations, international organizations. One of the benefits that Lifeline Malawi has experienced through this process is the partnership with the district health office in these various areas. And in the Ngozi area, the hospital close by, the Salima Hospital, actually provided us a nurse for a full month to mentor and provide orientation to our nurses, who were probably very nervous when the first baby was about to arrive. And that's been greatly appreciated. Professional development is deemed important in our organization, and we actively encourage our staff to continue their training. All of Lifeline Malawi staff are Malawian trained professionals. What does that mean to you in Malawi?
We, as a Lifeline Malawi Trust, are happy that maybe 98% of the personnel working in Malawi under Lifeline are Malawians. I mean, it's a recognition that we have the expertise, and also it is a way of capacitating our nationals, I mean, equipping them so that they can handle responsibilities of this nature. Again, there is also the question of making them self-reliant, that they can do it, they can handle it. Recently, as you know, we recruited the doctor, the medical doctor.
Yes, how
And I think, yeah, from all the assessments, he's doing a good job, and we are all happy with his performance. So it is Lifeline Malawi Trust is a Malawi institution. Yes, we have the Canadian colleagues, but it's doing work in Malawi. It's employing Malawians, and we have to support it as Malawi. And since government has deliberately mentioned that it alone cannot deliver health services, but it would want partners like Lifeline Malawi to come on board, and hence the assistance they are giving us through the nurse that visited, that came for 4 months, and other, assistance that is rendered. I think it's a welcome relationship. It's a welcome partnership.
We've been spending time talking about the past, where Lifeline Malawi has been, where we are today. Where do you see the relationship with Lifeline Malawi, the government of Malawi, and in particular your role as chair of the Lifeline Malawi Trust? How can we continue to work together to see positive change in the health status of these people in these rural areas?
One of the areas that I've been concerned with regard to organization of the Lifeline Malawi is the question of sustainability. I've always wanted a more sustainable methodology of financing the health delivery services that we are currently doing. And I am of the view that, yes, government is making a lot of contributions, but we need to have a way of running this thing without knocking on the door of Canada on every other day. And to that effect, I'm happy that we are now thinking of the endowment fund. It alone will not solve all the problems, but there is also the question of affiliating Lifeline to the Christian Health Association of Malawi, because I know that once that is done, the government will take on salaries for staff. Now, if staff are paid and medicines are found, I think we can run this without everyday financing from the donors. So we need to have a strategy of working without 80 or 90% of the resources coming from the donors.